One of the hottest issues in workers' compensation is immediate injury reporting. Let's talk about why immediate injury reporting is important. Option injury benefit plans commonly require 24-hour reporting for an accident that happens at an identifiable time and place that the employee knows about. The reasons: immediate medical care. We know that the faster the employee gets medical care, the faster they'll be healed and back to work. Physicians want to see employees immediately to determine the extent of injury and know what happened on the job versus something that may have happened off the job. More effective medical management is provided with the earlier diagnosis of the injury. These things are not rocket science, and that's basically how we achieve better medical outcomes through option injury benefit plans. But think about these other reasons to support immediate reporting. Investigation. When an accident happens, the employer wants to have the availability of witnesses. They want the scene of the accident to be just as it was when the employee got hurt so they can take appropriate corrective measures. Drug and alcohol testing won't be valid weeks or months after an accident occurs. Lastly, coworker safety. When an accident happens due to an unsafe condition or through some lack of training, we need to find out about that as soon as possible, not just to get the employee a better medical outcome, but also to protect coworkers. Now, most workers' compensation systems provide 30 days for an employee to report an accident that they know about. In contrast, 24 hours. Now, because of the outstanding results that option injury benefit plans have received, and because of the dialogue that the advancement of option programs has generated, some legislatures, like Tennessee and Oklahoma, are looking at 15-day reporting requirements. Now that's good. It's a considerable improvement in getting better outcomes and coworker safety. We cut the time frame in half. How does that make sense in view of the advantages of immediate injury reporting for both the injured worker and for coworkers? Now keep in mind, workers' compensation and option injury benefit plans will provide for a good cause exception to the mandated requirement. So, under an option injury benefit plan, the claims administrator is required to look to see, is a denial of benefits appropriate under the 24-hour reporting, or administering claims in the best interest of the employee, is there a good cause that supports a later report? Also keep in mind that the employee has received full communication of this reporting requirement prior to getting hurt. Unlike workers' compensation, we give a complete description of the employee's rights and responsibilities with a summary plan description and commonly videos and highlight brochures that make sure employees understand what the criteria is to report an injury. And by holding the employee more accountable, we're also able to provide better benefits. Workers' compensation provides not only 30 days to report the injury, jeopardizing coworkers, not getting the best outcomes, not providing the full communication of benefits, but then they also typically require the employee to wait 7 days until wage replacement begins. Option injury benefit plans typically begin benefits the very first day that the employee misses work. They don't have to take paid time off, vacation pay. We can remove weekly caps to increase benefits, and that's the balance. Why not require more accountability appropriately, checks and balances with a good cause exception and full communication, and then deliver better benefits for the injured worker?